The Shift is brought to you by SE Healthcare. Welcome to The Shift. I'm Dr. Andrea Coyle. Welcome back, Shifties, to the next episode of The Shift. As you know, this podcast was really started with you in mind. We wanted to put this podcast, and when I say we, I'm referencing SE Healthcare. We wanted to put this podcast together to highlight all the right in nursing. We also invite friends of nursing on this show. And the shift is meant to talk about shifts in your life, both personal and professional, that have made a difference in your life and made a difference in the lives that you touch. And today I am super thrilled to have an incredible guest that has a really uplifting, inspiring story. And I'd like to welcome the next shifty, Joe Walsh, coming to us from UPenn.
Hmm.
Joe, good morning. How's it going today?
Good morning. How are you, Andrea? Thank you for having me.
You are very welcome. I'm so glad to have you here. I just want to tell shifties how we met. I was doing a presentation at UPenn and I asked a question, and I really can't remember the question, but Joe got the answer right. Something to do with burnout. Joe answered the question correctly, and I had, in the meantime, mentioned the Shift podcast, and Joe mentioned the story that he's going to share with you. And I said, Joe, you've got to tell this story. It's incredibly inspiring and uplifting. So, Joe, kind of get started and talk to myself and the shifties about your shift and what happened in your life that created the shift.
Back when I was a late teenager, I discovered that I had a aortic valve murmur. I was being watched by my doctor during high school and sent on my way. And he said, you know what? At some point in your life, you're going to need to have your valve replaced. So fine. Years go by. Finally, in 1993, I had open heart surgery to have my valve replaced at Temple University. And at that time, I didn't really know what I wanted to do in life. I thought I wanted to be a police officer. I thought I wanted to do something in the community, but I struggled in school. And all of a sudden, I need open heart surgery and I need to stop school. So I was out of school for 6 to 8 months. I was recovering from heart surgery. And looking back, the nurses that took care of me kind of directed me indirectly to choose my career to be a nurse. It was not easy, but it gave me some sort of path to work on. Because at that time, I was at the lowest of lows, not knowing what I was going to do in my life. Um, After I recovered, I went back to school, but it was not easy. I actually failed out of nursing school, and
Um,
I was the lowest of lows until I met my wife, and she really helped me focus on school. It was not easy. I went to school part-time. I always say I did the 10-year, 4-year degree program
yeah.
um, because I was going to school part-time. I had a mortgage. I had a stepdaughter all of a sudden when I met my wife, and my life kind of changed. And I worked on it. I was persistent. I crawled back almost in a very small world that I had to focus on myself and get back into nursing school. I had to write a huge letter, huge essay to explain why I wanted to go back to school. Thank goodness Westchester took me back. And in 2001, I finally finished. But it was a very long journey. And once I graduated, it was a huge weight lifted off my shoulder.
Joe,
Um,
that's a really good story, and I'm going to ask you a couple questions based on a couple things I heard. Let's go back to the heart surgery. Was there a particular nurse or nurses that really you watched what they were doing and you were like, "Ah, man, this is where my heart is. This is where my passion is." Did that happen to you?
um, the biggest Couple things. It was before my surgery. They told me I was going to be okay, which, you're 23 years old. Nobody wants to be a member of the Zipper Club at 23. Um, they encouraged me. They reinforced that, they do this every day. So that really helped me deal with what was going on. And especially afterwards, they encouraged me to get out of bed that following day. It was not easy, but they said, you're going to sit in a chair. I don't care if we just cracked open your chest, but you're going to sit in a chair, and that's the first step. And just, it was so long ago. I don't remember their names, but it was their their funniness, their laughing, they're having fun. They love their work, and they took really good care of me.
Um, so Joe, I didn't ask this question, but tell us what kind of nurse are you right now? What's your specialty?
I've shifted many times.
I love that you
Um,
use the word shift. That's right.
yes,
Hmm.
and I am a electrophysiology nurse at Chester County Hospital, part of Penn Medicine, and I've been doing EP for about 5 years now.
Wow. Now, do you think you chose the EP lab just because of your heart history? Was that an interest to you, or is that just another shift in your career?
After hearing about EP about 15 years ago, people say you got to go to EP, you got to go to EP. I was like, no, I'm an ER nurse. I'm an ER nurse. No, I'm not going to EP. No, 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 no. Um, I shifted out of the ER after 15, 20 years being in that environment, and I was getting to the burnout, and I shifted to IR Cath Lab EP at Christiana Hospital, and I learned that, dealing with the ER, I was getting burned out, tired of all the triage, all the traumas, after all that time, I was like, I need to change. So I shifted to IR Cath and EP. And about 5 years ago, I made the change to do all EP all the time.
That's wonderful. And I think that's one thing that we emphasize a lot on the podcast is being a nurse, you have the ability to constantly make shifts in your profession and not only make shifts if you're in direct care or if you're not in direct care, but there's just endless opportunities. I think nurses rule the world, and I think nurses make the impossible possible. I think we could do anything. And when we try and think about this nursing shortage that has the eyes and ears of a lot of people, I would say to people that really are unsure of what they want to do, nursing is such a great career choice. Do you agree with that?
Yes, it's really, you have multiple opportunities to do anything you want. You can get your master's, you can get your doctorate, you can stay and get your bachelor's. What? Some of the best nurses I've learned from, all they have is their associate's degree from way back then. When?
Hmm.
Because they've been there, they've been at the bedside for a long time. And if you get tired of one thing, you can move on to something else. Um, you don't have to stick with what you're at, all the time. And for me, switching positions has helped me with my burnout. I never stopped wanting to be a nurse, but I wanted to do something different.
That's awesome. And burnout obviously has the attention of our Surgeon General. There are standards for magnet and PTAP and Pathway to Excellence that require that nurses and nurse leaders and organizations are taking a look at clinician burnout. How did you experience burnout? Do you remember the first feelings of burnout and what did that feel like? Because I want some of the podcast attendees, shifties, to recognize what some of the symptoms are of burnout because some people just don't know. They know they're not feeling right, but they can't put their finger on it.
Um, First thing is to recognize it yourself.
Yeah.
Some people, will fight it, fight it, fight it, and then it starts affecting other areas of your life. Um, if you recognize it first, I think that's a big first step. For me, I didn't want to, I was not looking forward to going to work and
Oh.
working that 12-hour shift. Then after I shifted out of the ER, I did IR and neuro. I was on call all the time. You make a lot of money, but it's not good mentally. Um, some people are, after, of course it's great. A year or two in, you're like on call, making a lot of money. Yeah, you're fine. But for me, when it gets to the fourth, fifth year of doing the on call stuff, I'm like, no, I need to make a change. And then we start worrying about the whole work-life balance thing, and that comes into play. But for me, is to recognize it first and get out before it starts affecting you.
The Shift is brought to you by SE Healthcare. Do you know your current burnout level? Almost 70% of hospitals and healthcare systems can't answer this question. What we do know are the devastating results of burnout. Increase in turnover, increase in medication errors and missed care, a decrease in the patient experience, and a decrease in quality outcomes. SE Healthcare can help with our evidence-based approach. Leaders can enhance nurse satisfaction and nurse engagement, improve quality care outcomes, and reduce burnout by 52%. Are you ready to uncover burnout's impact on your team? Visit us at sehealthcaresolutions.com/talk. You described recognizing it is really important. Some people, they know something's not right, but they can't figure it out. And the cardinal symptoms of burnout are exhaustion. So you don't want to get up, you don't want to go to work. So it's exhaustion. You become cynical or critical. Sometimes that sounds like maybe some venting before you have to go take care of a patient, or venting before you have to have a meeting with a certain person. And the other one is just lack of feeling like you're making a difference, lack of efficacy. And those are all reasons why we all get into healthcare.
Yep.
We want to provide the best possible care. We want to make a difference. And from humans, we all want to know what our purpose is. And I think when people can figure out what their purpose is, that helps decrease burnout. People think burnout's a problem. And if you really think about problems, the word problem comes from mathematics. 2 + 2 is 4.
Yeah, right. I think my enthusiasm went down.
Yeah, exactly.
Like, I was all enthusiastic being in ER. I was all enthusiastic being an IR,
And
you kind of lose it. Yeah.
You lose it. But when you find your why and recognize that burnout doesn't happen overnight, it happens slowly, and it's more of a dilemma than a problem. Once we realize it's a dilemma, then we can start to put solutions in place, which it sounds like when you shifted, you did put solutions in place. The other thing you said was work-life balance. And I've learned that UPenn likes to call it life-work balance, right? Yep. So it's funny, everyone has it. Some people don't even like to use the word burnout. It's work-life balance, work-life harmony, well-being. And UPenn calls it life-work balance, which I think is it's pretty interesting. So I'm glad you kind of brought up the topic of burnout, because it is a super, super hot topic right now. No pun intended with burnout and hot topic.
Yeah.
If you could share one thing that helped you make the shift when you realized you were burned out, what would that be?
It's one thing to be exhausted, from working hard. I don't mind working hard, but the other thing is being mentally exhausted. And just recognizing that and going to something new, or even a new place. Like, I haven't worked in the same place all the time. I've been different places. So I guess the mental exhaustion.
The mental exhaustion. And you said something else I think is interesting, and it's important for our shifties to recognize, is you said the burnout, and of course I'm paraphrasing, but you said the burnout started to come home with you.
Yes.
And that's, as a nurse, burnout becomes mobile. You start to take it around with you, and it can actually affect people's relationships outside of work. And that's when I spoke at UPenn about this. You have to put up boundaries. You have to say at 5 o'clock, I'm going to stop answering emails. Once I turn my ignition off or hit the button, whatever kind of car you have, I'm going to leave the burnout in the car in the driveway, or I'm going to leave in the parking garage at the hospital. But we have to be able to set up these boundaries so that we can start to mitigate that emotional exhaustion. And I don't know if you have any boundaries in place. Is that something that's been helpful in your career?
Um, usually when I get home, my wife always asks, "How's work today?" And over the years, she's heard all the stories. But it's for me to get that out, to explain what I've been through. She understands. She's in pharmaceuticals, so she has kind of knows what's going on in the medical world, but she hears all my stories, and that's just the way I can get it out without internalizing it. So,
And that's another really good approach is to find someone that you can trust and you can be vulnerable with and talk about it and get it out. And I think part of mitigating the burnout is finding the strategy that works best for you.
yeah.
Well, Joe, I'm so thrilled that we met each other at UPenn. At the end of every episode, we leave Shifties with a couple of inspirational words. And what words do you have for our listeners? People that might be in the process of a shift, people that might be burned out, people that might be thinking of even getting into nursing. What are some words of wisdom or some nuggets you'd like to share with the Shifties?
I think the biggest thing is resilience. Um, if you can hang in there and recognize the situation that you're in and be persistent. Sometimes we don't like our situations that we're in, um, but you will find something that you like if you need to make a change or you need to make a shift into some other avenue. And for me, another word I can think is persistence.
Mhm.
Even with school, if you're going back to school or you're doing, a different job or looking for a different job, is to be persistent in whatever you do.
So, Joe, as the clinical leader of the EP lab, I'm just asking the question because I know when I was in the clinical environment, I had my certification. Do you feel like when you have a certification that speaks to resilience and perseverance?
I think it actually helps my coworkers look up to me, like, and ask me questions and show some, respect, and they can be persistent with me to help them. Um, I I have a very small 6-person team, so there's not a lot of them, but we're all EP. We're all in the EP world. Um, but I think having a certification, when I got it initially, it really developed me into saying, I know what I'm doing in the emergency room. And I know, passing the test and stuff was a big accomplishment.
So, Joe, I think that's a really good point. I think if we could encourage shifties that if you're eligible, getting a certification helps solidify your expertise in a specialty. And it does give you a sense of accomplishment, to your words. And when we think about burnout and how people don't feel like they're giving enough or doing enough, certification is one way that can help validate your expertise in the specialty. So that's a really good point, Joe. And thank you for bringing that part up.
Hmm.
Um, any other words of wisdom you'd like to leave with the shifties?
Don't ever, let yourself um, be so affected by everything around you to affect you at home. I think that's one of my, you know, would be a breaking point if if you can't leave it at work and it's affecting you at home, um, I would not, it's probably time to make a shift.
Oh, I think that's a really good point. And I think that speaks to, do you waste or conserve energy on things that are in and out of your control? So don't let all of the surroundings in the work environment control you and then take that into your house.
Right.
Take that into your home. Take that outside the four walls of your organization. That's a really good point.
Yeah, and it doesn't have to be in your home. It could be your friends. It can be, your relatives. It could be your parents. Like, Everybody's in a different situation. So whatever situation you are, try not to let it leave the workplace.
That's a good point. Joe, I cannot thank you enough for really wanting to be on the shift. I'm really excited about this podcast. I'm sure the shifties are excited to hear your story. You do have a great story, and I'm so glad that you're able to be here with us today. You have a great story with your zipper. The zipper, I used to work in the cardiothoracic operating room, so I'm very familiar with all that. I'm glad you're here. UPenn should be so proud to have you. UPenn's a great system in Philadelphia and I think in New Jersey too, right?
Yes, they're in New Jersey too. Yep.
Wow.
And
So
I actually was a patient at Penn and down in the city back in September because I had my redo done.
oh, you had so you're a redo as well.
Mm-hmm. So,
Wow, very nice. So
but
congrats to UPenn.
I should be good and fixed now for the rest of my life.
That's great news. And thank you for being vulnerable and sharing that little piece of your life. That's what it takes for people to be vulnerable.
Yep.
And typically I end the shift saying, remember, shifties, the shift you make makes a difference. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify The Shift today.